The 2013 SPHPM Summer Vac program was a truly amazing 4 weeks. Not only did we get to experience real clinical research, gain clinical exposure through various excursions, including to the ICU and ED, but we also met so many lovely researchers and health professionals, plus a group of like-minded, bright individuals who are now close friends. Our program leaders, Barsha and Jay, made all these amazing experiences possible. We were each allocated to a department. Amber and I thoroughly enjoyed our time at ANZIC RC, the Australian and New Zealand Intensive Care Research Centre. First on the agenda was settling into the office. Continuing with the program, we went on numerous exciting excursions that varied from observing public health in action to building of crucial research skills. Back at the office, we immersed ourselves in the work of ANZIC RC. Here, I was under the guidance of Susie Morrison, Emma Ridley and Cecile Obron, my 3 amazing supervisors who have only furthered my passion for research. With Em Ridley, one of my awesome supervisors and senior dietitian in the Alfred ICU, I worked on various nutrition projects, including the Nutrition Adult ECMO Patients project. Good nutrition is a crucial component of hospital care, improving patient outcomes dramatically. Patients on the ECMO need to have their nutrition especially carefully monitored, as it changes their energy requirements and usage. ECMO is a device used for patients with cardiac or respiratory failure. Basically, their heart and lungs don't work properly and need the help of this machine called ECMO, which helps get oxygenated blood around the body. Previous studies have assessed nutrition in child ECMO patients, but there is a gap in the literature with regard to adults. Through this and a couple other projects, it was clear just how incredibly important allied health professionals are. Aside from nutrition and ECMO, I also worked on various other projects, including writing a literature review on the use of intravenous immunoglobulin in the ICU, under the guidance of my amazing supervisor Cecile. Also conducted searches for systematic reviews and made products for various studies. ANZIC RC runs many clinical trials, including
TEAM is a trial of early activity and mobilisation. Our aim is to start rehabilitation very early, get patients who are still on mechanical ventilation up and moving.
The particular study I look after is the transfuse study, which is looking at old versus fresh blood in ICU patients.
The trial is a cooling study. We do early and prolonged cooling.
Bilateral ventilation study in patients who've got ARDS.
I wish I had time to talk about all the ANZIC RC projects, all run by truly wonderful leaders and researchers. During our time at SPHPM and ANZIC RC, we've met so many wonderful staff who are not only researchers, health professionals and leaders, but role models and friends. They have made this program feel like home.
I think public health is a real translational medicine where it's at the cutting edge of actually bringing real solution to real problems that we face in society today.
The great thing about public health in the future is that across a whole population it will make a change in whatever discipline or area you're studying, if that's osteoarthritis, if that's patient safety, if that's occupational health and safety. Wherever you're researching, patient outcomes should improve and population health should improve.
Underlying all of this research, the writing of ethics approvals, recruiting of patients, analysis of data, is the hope that step by step, trial by trial, patient care will be improved, lives will be saved. Behind each of these faces is a story of laughter and sorrow, of family and friends. Through research, a beacon of hope shines that the hardship endured by patients and their loved ones will be lessened, that less pain is felt, less illness is experienced, and ultimately that less have to say goodbye.
I guess it's a moral question about the research that we do. It's not driven by money, the main aim is to improve things for patients.
It's something which opens doors to what you like, which can be bedside research but also social.
Critically ill patients are such an important patient group, a group that's quite often left out of your big research budgets and your big fundraising streams and that type of thing.
As things are changing, people are finding new ways of doing things.
Improving the treatments for people that come into hospital all over the country or all over the world.
One experience made the importance of public health painfully clear. On the last day of the program, as I was about to leave, I heard the story of a girl my age. She had been diagnosed with a most rare and advanced form of cancer. My thoughts go out to her and her family. I want to thank SPHPM and ANZIC-RC for giving me the wonderful opportunity to return again this year to continue on some new and old projects. Now, I look forward to a lifelong journey in research to contribute as much as I can, no matter how small.